Hello to all of you. So we will be going to have a rapid image session for the anatomy. And before we start with the session, see, this session is very, very important and a high yield session for your upcoming exam, the FMGE exam, and as well as it will be helpful for the NEET exam also, or all other exams. So very, very useful because this is having all the important images. And after the image discussion, I will also have a small discussion on the vertebral levels. I have included the vertebral levels also in this session. So believe in yourself. That is very, very important. Believe in yourself. You can do it. Try your best, stay calm and smash it. So let us start quickly with this revision. First of all, I'm going to discuss all the important sections in which, let us see this section. This is very, very important, the sagittal section of head and neck. You should be able to identify this frontal sinus. Over here, U-shaped depression, sella turcica, very, very important. Just below it, this sinus is what? This is the sphenoid sinus. The hard palate, behind it, the structure is the soft palate. And then as we come towards over here, this is tongue having the genioglossus. When you see towards the lower side, you should be able to identify the epiglottis over here. Plus, you should be able to tell these cartilages. This is the location of thyroid cartilage. Okay, this is the thyroid cartilage. Below this blue colored area, which I have shown over here, this is showing the anterior as well as posterior aspect of cricoid cartilage. Now, this is for the brain. The sagittal section, very, very important, all these landmarks. You should be able to tell the brainstem that this is midbrain, pons, medulla, cerebellum, and between the two, you are having this triangular ventricle, which is the fourth ventricle over here. Then after that, we say that when you talk about this structure, this C-shaped structure, corpus callosum, a blue colored structure, which we have shown over here, this is what fornix. Below the fornix area is thalamus, and then below the thalamus, I've written over here H. This is hypothalamus. Okay, this is hypothalamus. Then towards the posterior side, as the corpus callosum is finishing, you can see over here this irregular area or irregular structure which you see. This is what? Pineal body. So you should be able to identify all these structures. One more over here, this is pituitary gland. Very, very important. Now another, this is the transverse section of the brain. Yes, you should be able to identify caudate, blue colored, green colored thalamus, and this orangish colored is what? Lentiform nucleus. And in between these, what we are having, this V-shaped structure over here in between is internal capsule. This is the internal capsule. Then apart from this, adjacent to this caudate, the triangular dark area over here is lateral ventricle. Between the thalamus, this dark colored area is what? It is the location of the third ventricle. Then apart from this, when you see from the lateral side, this sulcus over here, lateral sulcus, the area around it, insula. This is the insula. And on the posterior side, when you talk about the sinuses, the triangular area which is over here, this is superior sagittal sinus. In front of it, the circular area is what? It is the straight sinus. It is the straight sinus. Now, one more section is there, which is coronal section. The coronal section is like this. And when you see the coronal section, exactly the same arrangement is there with few more structures. What is the arrangement? Exactly the same arrangement. Caudate, thalamus, lentiform. In between this, whatever V-shaped area you see, that is the internal capsule. Similar lateral sulcus. Over here, this is the, this is the lateral sulcus. I will just correct it over here. This is the lateral sulcus, and the area around it, is what? It is the area given the term as insula. Okay, so this arrow which I have put over here, this is on lateral sulcus. Okay, this is the lateral sulcus. Then apart from this, what do you see is this area which I have marked over here. This is the location of the fornix. Apart from this, you can also see over here, I will just zoom it for you. This darkish colored round area, this is the location of red nucleus. And then over here, this slightly pigmented area over here is what? This is the substantia nigra. So you should be able to identify all these structures in this image. Okay. Next is, yes, transverse section of the abdomen. Very, very important. You should be able to, first of all, whenever you see such transverse section, see where the vertebra is there, so that you are able to tell that this is the posterior side and another is the anterior side. Then over here, you should be able to tell liver, stomach, spleen. Okay. And on the posterior side, when you talk about these oval shaped structures, these are what? Kidney. Over here you have the right kidney and the left kidney. Then just in front of vertebra, the aorta, the section which you see is aorta. Which aorta? Descending aorta. And this blue colored section which you see over here, this is what? Inferior vena cava. This is the inferior vena cava. Now apart from this, when we talk about lesser omentum, the lesser omentum is a connection between the fold which is between the liver and stomach. And when you see this fold on the liver side, what do you see? The structure which is present is the gastric vessels. And when you see towards the liver side, what do you see? All these three structures which are what? Portal triad. So these are the contents within the lesser omentum. Now as you talk about these two ligaments, so when you are talking about these two ligaments, what do you see is, first is between stomach and spleen. Over here, this blue colored which has been shown over here, this is what? Gastrosplenic. And the other one which is shown over here between this spleen and the kidney. Over here, this is what? This is the splenorenal ligament. And now the splenorenal ligament, you should be knowing very well that what is the contents. Very, very important. The content is splenic vessels and tail of pancreas. Very important. Next is the transverse section over here in the neck, trachea. In the front, posteriorly, you are having esophagus. In the trachea, you are having this blue colored structure. What is this? Yes, C-shaped hyaline cartilage. And if I say this is a C-shaped hyaline cartilage, then behind it is completed by a muscle which is trachealis. Okay, so this is of the neck. Then yes, thorax area. When you say thorax area, again, see the vertebra. Where the vertebra is there? When you see the vertebra over here, this is a location of vertebra. This is the body of vertebra. So this is posterior side. Start from the vertebra. So it will become a bit easier for you. So when you start from the vertebra, just in front of that, whatever section you see is the section of aorta. Which aorta? Yes, descending aorta. Then as you come in front of it, another section you see is what? Esophagus. Then further, when you're reaching in front, this whole area is what? It is the heart. And to be more specific, we say that on the most posterior side, the chamber. Okay, so on most posterior side, over here, this location. What is it? This is the location of what? Left atrium. So the chamber which is most posteriorly placed or which is near to the vertebra, this is what? It is the left atrium. Very, very important. Same section or same image, if it is given radiographically like this, same thing is there. First you see vertebra. Okay, this is the posterior side vertebra. Now, whatever chamber of the heart, see, this is a section of the heart. Whatever chamber of the heart is more near to the vertebra, that is left atrium. Okay, that is left atrium. Now, in the thorax, one more section is there, which is very, very important. And what is this? In this section, characteristically, you will see two big circles. Okay, what is this? Both are the section of aorta. First, you see vertebra. Now, this is the vertebra. Over here, so this is the posterior side. Whatever section is near the vertebra is descending aorta. Always it is descending aorta. So if this is descending aorta, in front of it, another round section is ascending aorta. Now, along with the ascending aorta, a small section you see is of superior vena cava. And very, very important, between these structures, you can see a irregular section over here. This is the location of pulmonary trunk. Very, very important. Pulmonary trunk. You should be able to identify them. Now, this is again a section of the abdomen. Okay, the radiographic image in which again same things are visible, which you should be able to tell. Very easily seen vertebra. So, posterior side, liver. Then you can see over here, this is the location of stomach. This is the location of spleen. As well as over here, you can see some part of the pancreas. Okay, pancreas. Now, adjacent to vertebra, the oval shaped structures, kidney, right and the left kidney. In front of the vertebra, what do you see? Yes, the round section which you see is aorta, descending aorta. Another section which you see, another portion which you see is inferior vena cava. So, the vessels also you should be able to identify. Now, let us discuss some important X-rays. And in this, first of all, the upper limb X-ray, the shoulder joint, very important, easy structures, clavicle. Then very, very important, coracoid process. You should be able to identify coracoid process, which is a prominent seen towards the inner side. And when you see a projection on the outer side over here, this is acromion process. Then in the humerus, greater tubercle of humerus, whatever prominence you are seeing on the outer side over here, this one. Okay, over here this is the head, but when you see this prominence over here, this is the greater tubercle. Then surgical neck and shaft of the humerus. Very, very important landmarks, easy to answer, scoring questions, and there is no scope for error. ठीक है, कोई error नहीं होनी चाहिए इसमें, ये ध्यान रखना. Now over here, this is the X-ray of the hand, and when you see over here, you should be able to identify, you should be able to differentiate all these joints. When you see over here, starting from here, you say this is radius, and over here the carpal bone. So the joint over here is what? Wrist joint. Okay, wrist joint. Then this one between the radius and ulna, this is what? Inferior radio ulnar joint. Now as you come towards the hand, this is the carpal bones, this is the first metacarpal. So this joint over here is first carpo-metacarpal joint, and you know very well this is what? This is the metacarpophalangeal joint. So you should be, in this image, you should be able to differentiate all these joints. Now in the head and neck area, the neck area, you should be able to identify all the vertebra. So when you see the base of skull, it is finishing over here. Whatever spinous projection you see, first is C1, and after that you can do the counting. And when you identify C1, you can identify the whole vertebra accordingly. Okay, then in the front, whatever small bone you see, this is what? This is the hyoid bone. Now over here in the pelvis, very, very important landmark that you should be able to identify this pubic symphysis, and on its either side is the obturator foramen. So when you see this X-ray over here, yes, of course, over here this is the location of pubic symphysis. On the either side, this one and this one, this is what? Obturator foramen. Now apart from this, you should be able to identify femur. Very, very important. There should not be any error in this. When you see the femur, head of femur, this big prominence, greater trochanter, a small prominence on the inner side is what? Lesser trochanter. Okay, very, very important landmark. Now another is the X-ray of the foot. This is a superior view, and this slightly curved bone is what? Navicular. And how do you confirm? You confirm by seeing that it is on the medial side. Okay, medial side, you how you identify? You will see towards the great toe, the metatarsals and the tarsal bone, the metatarsals and the phalanges, they are more broader. So you can identify that as the great toe, that is a medial side. On that side, the navicular should be there. If the navicular is over here, of course the cuboid is on other side, that is the lateral side. Now in front of the navicular, you are having what? Cuneiforms. Fine. Very, very important. Now in this is a chest X-ray in which you should be able to tell whenever, like you are counting the ribs, you should be able to count the ribs from here, 1, 2, 3, 4. Next thing you should be knowing is that whatever portion of the rib you are prominently seeing over here, this is what? This is actually the posterior part of the rib. The anterior part of the rib is slightly faded in the image. So whatever portion you are actually seeing over here, all these are the posterior parts. Okay, anterior parts are like this, which are slightly faded. This you should be able to tell. Now quickly we will talk about the important congenital anomalies which you should be able to identify, and in one line you should be able to tell that what is the problem over here. Fine. For this is anencephaly, which is actually what? Defect in the closure of the cranial or anterior neuropore. Then this is a spina bifida, which is the defect in the closure of what? Caudal and the posterior neuropore. This condition is craniorachiasis, which is again the neural tube defect, the severe form of neural tube defect. Over here, cleft lip due to the defect in the fusion of what? Medial nasal process and maxillary process. Omphalocele, that towards the umbilicus you see a sac-like structure having the intestines covered by amniotic membrane. So what is the reason? Due to non-reduction of physiological hernia of midgut or non-return of midgut. Now this is an image for annular pancreas. This is what? Yes, horseshoe kidney, and the lower fused part, its ascent is arrested by what? Inferior mesenteric artery. Now this is a cyanomelia in which the lower limbs are fused, and this is due to the defect in gastrulations. Specifically we say the mesoderm is affected. Now over here in the ear, in just front of the ear at this location, what do you see? A small depression, and this is preauricular pit or sinus due to non-fusion of first and second pharyngeal what? Arch, pharyngeal arch. Now let us discuss other important images one by one by region wise. First of all, in the scapula, you should be able to identify coracoid process, acromion process, and this is the inferior angle of scapula, right? Very, very important humerus. Most scoring, no scope for any error. You should be able to identify surgical neck, spiral groove at the location of shaft, medial epicondyle. Apart from this, greater tubercle, lesser tubercle, and in between the two. The vertical sulcus which is present over here, this vertical sulcus, this is what? Bicipital groove. Very, very important. Then in the radius and ulna, few landmarks. In the radius, this is radial tuberosity. In the ulna, the projection above is olecranon process. Now, few deformities or we say lesions in upper limb is you should be able to identify with the help of image policeman tip deformity, which is Erb's palsy. This is what? This is, yeah, if you see over here, this is a dropped shoulder, which is due to the involvement of spinal accessory nerve. And when we talk about this image, this is what? Winging of scapula over here, which is due to the involvement of what? Long thoracic nerve. This is due to the injury of long thoracic nerve. Then the muscles we should be able to identify. Pectoral region, big muscle, pectoralis major, small muscle, pectoralis minor. Then as we see serratus anterior. For the serratus anterior view, the muscle is present on the lateral aspect, and when you see this image, this is a lateral view, and you can see on the lateral side the complete muscle is shown over here. Yeah, towards the back area. Now towards the back area, big muscle on the upper side, trapezius, and on the lower side the big muscle is latissimus dorsi. When you remove the trapezius from above to below, this is levator scapulae, rhomboidus minor, and this is a rhomboidus major. You should be able to identify these muscles. Then apart from this, when you see towards the scapular area, you are able to see these muscles. What is this? Above the spine of scapula, this muscle supraspinatus, below spine of scapula, this is infraspinatus, and then apart from this, between the scapula and humerus, two muscles running parallel, black one teres minor, green one teres major. So you should be able to identify all these muscles. Now for the forearm, yeah. Now in the forearm, all the muscles, anterior compartment muscles starting from medial epicondyle running in different direction. First of all, the smaller muscle pronator teres. Then this is going to the till the wrist. So this is what? On the lateral side, it is flexor carpi radialis. This is flexor carpi ulnaris. In the center, pink colored muscle is palmaris longus. When you remove all these muscles, just deep to it, flexor digitorum superficialis, going to the digits. And when you see this image, you should be able to tell that at the wrist, the tendons which are seen is towards the thumb lateral side, flexor carpi radialis. And on the medial side, flexor carpi ulnaris. In the center, this one, palmaris longus. Now, when you remove all the muscles in the deeper aspect, if the muscle is going to digits, flexor digitorum profundus. If it is going to the thumb, flexor pollicis longus. In the hand, very, very important muscle, lumbricals. Counting starts from thumb side. Okay, so 1, 2, 3, 4. Now for the anatomical snub box, this image is very, very important. Very, very important for you to tell which is medial boundary, which is lateral. You should be able to identify the boundary which is more near to thumb. It is what? Lateral boundary. And the other one is what? Other one is medial. And the muscle forming it is extensor pollicis longus, medial. The other two muscles forming the lateral boundary. Then the nerve lesions are leading to the deformities, like median nerve injury leads to ape thumb deformity, and this is the benediction deformity, this is the pointing index. You should be able to identify it perfectly. When you see this, this is a partial claw hand, which is due to ulnar nerve injury. And in this wrist drop, yes, radial nerve injury, which is associated with what? Crutch palsy and the Saturday night palsy. Then Fallon test, which is done for what? Carpal tunnel syndrome, that is for the median nerve compression. Axillary artery branches identification. Axillary artery starting from the outer border of first rib, going till the lower border of teres major, crossed by the muscle pectoralis minor. divided into three parts: first, second, third. You should be able to identify the branches, specifically these three branches. First part is giving one branch, superior thoracic. Second part is giving this branch which runs parallel to pectoralis minor, running just close to it, lateral thoracic. If this is a lateral thoracic, another branch is what? Thoracoacromial, this one. Now, any artery which is running parallel to the lateral thoracic, that is subscapular. So this is the subscapular, and then you see the other two branches which are forming a circle, that is circumflex humeral artery, the anterior and the posterior circumflex humeral artery. Now, very, very important, dermatomes over here. You should be able to tell the dermatomes when you remember for the upper limb. Yes, very well we remember like this, from outer to inner. So it is C5, C6 till the thumb, C7, C8 starting from little finger, and T1 over here, T2 in the axilla. Then in the thorax region, you can see horizontal dermatomes, very important, umbilicus, dermatome T10. Now in the lower limb, what we say, anteriorly it is lumbar, and then you take a turn and go posteriorly. So anteriorly the numbering is going down, lumbar going down, and posteriorly the counting is up. So sacral counting is up. So from here, L1, L2, L3, very important in the leg area. The L4 is towards the medial side and L5 is towards the lateral side. Then starting from the posterior side, starting from the sole, in fact, this is area is S1, posterior aspect of leg and posterior aspect of thigh S2, and the rest of the dermatomes S3, S4, S5 in the gluteal region. Yes, this is a very, very important landmark. There should not be any error in this, zero error. Pterion, what lies deep to it? Middle meningeal artery and lateral sulcus of cerebral hemisphere. Now for the mandible, this foramen which is on inner side, mandibular foramen, and what passes through it? Inferior alveolar nerve and vessels. You should be able to identify it. Now when you talk about this image for external carotid artery branches, first of all, in this image you should be able to tell that what is this? This is common carotid artery which divides into over here external and internal. Now the external is the one which is going towards the you can say head area, and it is giving the various branches. Now when you talk about the various branches, most important, the artery running obliquely in the face, facial artery, most important artery, facial artery. Now for the blood supply of the brain, circle of Willis. First of all, you should be able to tell this is vertebral artery. Okay, this is the vertebral artery which combines to form the basilar over here. And this component is what? Internal carotid. Now in this image, the artery in which no error should be there. Which one? From the vertebral outer side branch, pica, posterior inferior cerebellar artery. And the branch which is on the inner side, this one on the inner side, anterior spinal artery. There is the anterior spinal artery, very, very important. Now for the femur, we already mentioned, you should be able to tell greater trochanter, very important. On the inner side, small prominences, lesser trochanter, very, very important. This is for the foot, superior view, you should be able to identify all the bones. This is talus, just below it calcaneum. Now in front of talus, you have navicular, slightly curved bone, in front of it cuneiforms. Okay, and when you see the calcaneum, in front of it you have the cuboid. Same thing over here. This is the medial side where the great toe, where the phalanges and the metatarsal, they are broader. Now even if you see the view from the sides, you can identify that this is the talus, calcaneum, in front of talus, slightly curved bone is navicular, and this another image, again the same thing, talus above, navicular below. In front of talus, bone is navicular, and when you say in front of calcaneum, it is cuboid. Okay, so either of the view is there, you should be able to identify these bones. Now over here in the leg area, these muscles, you should be able to tell. If any muscle over here is going to what? Great toe, named as hallucis, extensor hallucis. Extensor because in the lower limb, extensors are anterior, flexors are posterior in the lower limb. So this is extensor hallucis longus. If it is going to digits, it is extensor digitorum longus. And a third muscle, tibialis anterior, it is finishing bit early. Okay, it finishes in the middle of the foot. Now this you should be knowing that if this image is given, this is doing, in this we are checking the Trendelenburg sign, and when this is shown, this is what Trendelenburg sign positive. Okay, that when you keep one foot on the ground, the pelvis is sagging down or the pelvis is falling. So this is sign positive. If this image is given to you, you should be able to tell it. Another, this is the artery in the foot, anterior tibial, posterior tibial artery. Anterior tibial artery continues into dorsalis pedis, and the posterior tibial artery going to the sole. Now over here, the posterior tibial artery identification, very very important. In fact, you should be able to tell that this image is showing the pulsation of posterior tibial artery. Where is it taken? You should be knowing that landmark very well, that it is between the medial malleolus and tendocalcaneus. It's medial border actually. Okay, so over here, this one pulsation we have mentioned posterior tibial artery, so I am going to mention the other pulsations also. This is the image for dorsalis pedis artery pulsation. Over here, it is lateral to the extensor hallucis longus tendon. Okay, this pulsations we have completely discussed in the live YouTube session for 25 important questions. Over there, we have properly discussed all these pulsations. This is showing the radial artery pulsation, and this one is showing you what? This is showing you the common carotid artery pulsation. Then after that, yes, planes. Very important. Whenever the quadrant planes is there, in the quadrant planes we say the upper plane is what? The upper plane is subpostural and the lower one is transtubercular. You should be very well knowing it is subpostural L3 upper border, transtubercular L5 lower border. And when you talk about this another image, over here, the plane passing through highest point of iliac crest, supracrestal plane, and a plane which is higher up, very high. This is transpyloric. And in this also you should be knowing the vertebral levels. The transpyloric L1 lower border, supracrestal is L4 lower border. So in the image you should be able to identify the planes. Now when you see this image for the arteries over here, for the stomach, from here, if you see this one, this is the aorta, from where the celiac trunk is there. This is the celiac trunk over here. This is labeled over here. And it is giving the three main branches, one to the stomach, left gastric artery, one to the spleen, splenic artery, one to the liver. This is common hepatic artery, right? Very, very important branch. Artery over here is what? This one, greater curvature, gastroepiploic. If it is coming from the left side, it is left gastroepiploic. If it is seen towards the right side, it is right gastroepiploic. So you should be able to tell gastroepiploic. Diaphragm. It is what? Inferior view of the diaphragm, and when you are seeing over here, you always see tail-like projections on the posterior side. So over here you can see this whole is a rib cage, and behind over here this is the location of vertebral column, the tail-like projections crus, and three major openings. You should be able to identify these three major openings. What is this? VOA. Okay, VOA, from anterior to posterior. For that we say voice of America, from anterior to posterior, vena cava opening, esophageal opening, and lastly the aortic opening. So either this image or the normal image is given, you should be able to tell. Sternal angle, this is the image showing this sternal angle over here. And what is this? Vertebral level T4 lower border. Now this image very important for you to identify. Mediastinum image, one lung removed, and then you are visualizing from the lateral side. What do you see? This is the heart over here. This is the aorta, arch of aorta, then descending aorta. Behind you have the vertebral column. Now over here, two nerves which you should be able to tell. This nerve which is running anteriorly along with the heart is phrenic nerve. And if you go slightly on the posterior side, this nerve is vagus nerve. So you can say this is the hilum area over here. This is the location for the hilum of the lung. In front of that, phrenic, behind vagus. So either this image is given or this cadaveric image is given. You should be able to identify in both. Again over here, when you see this nerve running along with the heart, phrenic. If you see another nerve which is like this, which is running like this is what? Vagus. Okay. Okay, some images of embryology also. In this ovary, you should be able to differentiate between primordial, primary, secondary, tertiary. And primordial follicle, the oocyte, primary oocyte, is surrounded by a single layer of cell. Then if it is multiple layer of cell, it is known as primary. If the antrum develops, it is a secondary. And if the antrum is properly developed, it is what? Graphian follicle. Okay, this is the Graphian follicle. Now, this is the image for the development of diaphragm. And when we are talking about the development of diaphragm, again when you see the vertebra, posterior side, this is the anterior side. Anterior side, the whole area, this pink area is formed by septum transversum. Very, very important for you to know septum transversum. Posterior side, we say orange colored area by pleuroperitoneal membrane. This image you should be able to tell whenever you see this image. This is arches, 1, 2, 3, 4, 6 pharyngeal arches, okay. And when you see any depressions from outer side, clefts, 1, 2, 3, 4 clefts. If you see the depression from inner side, from the inner side, 1, 2, 3, 4 pouches, the pharyngeal pouches over here. Okay, over here also the counting is the same, 1, 2, 3, 4. So 1, this is 1, 2, 3, 4. Right. Now another image over here, this communication which is between the pulmonary trunk and this aorta over here, this is, you should be able to tell that this is the ductus arteriosus. In the images, histological images, you should be able to tell this is the keratinized stratified squamous epithelium. This is a keratin layer and this is non-keratinized. So whenever you see the image, you should be able to differentiate it. Similarly, you should be knowing this histological image for ciliated pseudostratified columnar epithelium, and this is what? This is the transitional epithelium. Okay. Now over here only, I have discussed also, this was about the images. Over here only, I have also discussed about what? I've discussed about this vertebral levels also. Okay, we have discussed about the vertebral levels also. So now when we are talking about the vertebral levels, I will quickly mention the vertebral levels also, because they are very, very important and high yield, again the high yield topic. First of all, vertebral level of neck area. In the neck area, two important vertebral levels. First is junction of C3, C4, another is C6. Okay, I have written all of them. But in this also, if you say that, ma'am, which is most important, junction of C3, C4. What is very important over here? It corresponds to which point? It corresponds to upper border of thyroid cartilage. Okay, it corresponds to upper border of thyroid cartilage. Then apart from this, at this level, the common carotid artery bifurcation. Bifurcation means it divides into internal and external. Another is C6. Very important, it corresponds to what? Lower border of cricoid cartilage. A very, very important landmark which is happening over here is carotid tubercle, Kazanec tubercle, which is basically for what? Common carotid artery pulsation. Very, very important landmark. These highlighted points are very, very important over here. Then when you say in the thorax area, what are the important landmarks? So I've written all the vertebral levels which are important for us. In that also very, very important is the sternal angle of Lewis. T4 level, which border? Lower border. Inferior angle of scapula, we know it is at the level of T7. Okay, T7. Now this is what? This is the openings of the diaphragm at different level, for which we remember like VOA. Okay, Voice of America. Na? So VOA, for that we remember 8, 10, 12. So that means the V is at T8, the O esophageal opening is at T10 and A is 12. So A is at the level of T12. Now very, very important, another is vertebral level for planes, abdominal planes. And in this, we remember like this, L1, L3, L4, L5, 1, 3, 4, 5. 4 planes, first of all, the highermost, okay, that is transpyloric, L1. Then L3 subpostal, then L4 supracrystal, L5 is transtubercular. So how you remember over here? You remember 4 planes like this, and you remember 1, 3, 4, 5. This is lumbar 1, 3, 4, 5, in which you can see over here alternately they are present, like the subcostal and transtubercular, which are the quadrant planes. They are present alternately along with the other 2 planes. Okay, so 1, 3, 4, 5. Now over here only we also mentioned that L4, we are also having important vertebral level of umbilicus, which is actually the upper border of L4. Spinal cord ends at what level? Again, this is a very, very important vertebral level. It ends in adults at L1, what? Lower border. Wherever we have mentioned the borders over here, all the borders are important for you. If I say spinal cord in newborn ends at L3, upper border. Then subarachnoid space ends at what level? S2, lower border. So these are all the important vertebral levels. And apart from this, I have also written all these vertebral levels for this abdominal region in in order, like T12 to and L1, then L1, L3, L4. So in order, I've written the whole list also, so that if you want the whole list all together, like according to the vertebrae, if you want, the whole list is there. Now in this, very, very important, you should be knowing the portal vein formation occurs at L1 level. Then I've marked over here these two landmarks. This is also very, very important. The abdominal aorta termination, L4. And when you say IVC, inferior vena cava formation, it is what? At the level L5, right? And one more landmark, PSIS, posterior superior iliac spine of the hip bone. It lies at what level? S2. It lies at the level S2. So all these are the vertebral levels which are very, very important for you. And thank you to all of you for listening to this session, and I hope that this session is very, very useful for you and very high yield for you before the exams. So best of luck to all of you. Keep doing well and rock the exams.